Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our Hospital System General Director, providing you the update from Albany Medical Center. Today is Thursday, August 13th. Okay, let's start with the numbers. In the 8 counties of the Capital Region, these are people currently being treated for COVID-19, 40.
Same, it hasn't really changed, Dennis. We're really hovering.
Next graph is Albany Medical Center admissions and discharges. And I think on this graph, what's important to point out is we sometimes will go several weeks without having anybody die from COVID-19. Yes. I think we had one earlier in the week, but other than that, it's been a long time.
Yes.
Some days 1 or 2, and some days none. And that gets us to the current morning census here at Albany Medical Center. We currently have 13 in the hospital, and Fred, all of them are outside the ICU, so none of them are on the ventilator.
That's right.
All right, very good. So we'll keep a close eye on those numbers. Fred, there's some interesting data that came out of the UK today, and I think it sort of speaks to some of the numbers we were talking about earlier in the week as far as we're learning more about the virus and how active it is in the population.
That's right, Dennis. And some of what we're learning is reinforcing what we've thought. So the UK actually tested 100,000 people for antibodies.
Okay.
And then from that testing, they back calculated. And they've calculated that 3.4 million people in the UK have been infected with COVID.
Okay.
Based on that testing. The UK has about 68 million people, so it's about a 6% or so infection rate. So pretty substantial.
Yes.
They estimate that 2/3 of the population are completely asymptomatic.
Wow.
And again, that goes along with what we've been seeing in other numbers that are being published. And then when you look at the mortality against that 3.4 million, again, it fits with what we said the other day. It's a couple of times more than flu, but not 10 or 20 times more.
I think if you calculate the infection fatality rate based on those numbers, they're in that 0.5% to 1% range.
Correct.
And of course, as we talked about on Tuesday, if you break it down by ages, it gets completely different.
That's right.
I think we said for children in the age of 5 to 9 the other day, it was 1 in 62,000. So differences by age. But the UK study is very interesting.
Yes.
Okay.
It reinforces some of the other numbers we're seeing.
All right. We like to bring you those studies, and we'll certainly bring you more as they get published. Fred, you've been leading an effort in the hospital to get us to think about what are the products we use,
yes,
to be sure we have enough on hand so that in the future we don't run out of anything. And one of those things is hand sanitizer.
Hand sanitizer.
So I think we have an example here, and thank you to you and the efforts of John DePaula and others who are looking at that. We now have adequate number of hand sanitizer gel in the hospital, and we want to talk about it.
That's right, Dennis. So we have struggled a bit with the wall-mounted hand sanitizer. So the supply folks have found this product. We've purchased a lot of it. It's locally made, comes from Saratoga.
Which is great.
It's made by a company called Argo Chem. Mm-hmm. It meets all the requirements for hand sanitizer, and this is being dispensed around the hospital and the practice sites now.
That bottle actually comes from my office,
yes,
so I need it back.
Yes,
because that's the one we use upstairs.
You've used a fair bit.
I have. We use it a lot. So thank you, and I'm glad that we're using that. And we just wanted to say to our workforce, that's obviously a product we encourage them to use.
Absolutely. And you know, Dennis, something to talk about with regards to that, we don't want you to bring product in from home. We want you to use what we supply you. I think that's very important for the workforce to remember.
Yeah. And if there's areas that are running low, talk to your management and let's make sure we get it restocked.
I think we have plenty of this particular product.
Good. Let's break in the middle of this video and let's kick it out to France Beer Alpert, who serves 2 incredibly important roles here at the Medical Center. She is not only our Chief Financial Officer, she's also our Chief Operating Officer. For those who don't know, Fran's been here for 20 years at least.
20 years,
yes.
Yeah.
Local from Voorheesville. And so she wanted to make an important announcement, Fred, about some reorganization within finance.
That's right, some restructuring in finance.
Very good.
So let's hear what Fran has to say.
Recently, we've had an incredible opportunity to reorganize our revenue cycle function that sits inside our corporate finance team. And we had some important core principles in mind when we went forward with trying to come up with that reorganization plan. One of those core principles was to integrate the hospital and practice functions. We have not done that previously. Another important goal was to identify the great talent that we have inside of Albany Med and look for opportunities to further grow their careers and give them a chance to do something new, more challenging, something different. Also, we wanted to create a structure and an organizational chart that allowed us to pursue goals that we've had on our list for many, many years but have not been able to adequately attack. One of those important goals is to establish a centralized scheduling and registration process for Albany Medical Center, and equally important for the entire system, of great value to all of our patients and to our community, and it would make life much easier for our team, both clinical and administratively. In terms of the new structure, our Vice President for the Albany Medical Center Rev Cycle will be Shelley Breton. Shelley Breton has been with Albany Med for almost 20 years. She has been in charge of the practice billing function, has recently taken over the practice front-end coding function as well, and in the last year took on Saratoga physician billing on behalf of the system, and has done a wonderful job doing all of those. Excellent record and excellent statistics, and she's very excited to start working with the entire team. Again, in that theme of creating a much more integrated revenue cycle organization, Gary Manduca, who has been with us for over 21 years, will be taking over hospital and practice billing functions. So Gary has been responsible for the hospital billing. Now he will take on the practice billing as well, and partner with Shelley and the rest of the team to do a lot of good work there. In terms of patient access, Kathy Palazzi, who has been with us for 32 years, will be elevated, as just like Gary, to an assistant vice president position in charge of access, and she will be charged with not only creating a succession plan and succession process for the roles she's playing on a daily basis now, but also creating that vision and that plan and that team for putting together a centralized registration and scheduling process. Carolyn Hastings has been with us not quite a year yet, doing a wonderful job with hospital coding. She, again, in the spirit of integration and in the spirit of providing opportunity for our employees, she'll be elevated to an AVP position and taking on the coding function for both the hospital and the practice. Last but not least, Donna Burvey, who has been with us for 30 years, will be taking on a role in charge of the revenue cycle integrity process. And what that means is she will be helping all of the teams ensure that we collect and maximize what we collect from all of our payers across all of our different services. In addition, she'll help minimize our risk, making sure that we're doing what we do within all of the various guidelines and regulatory rules that we need to follow. I am so proud that we have such an incredibly talented team. So thrilled that we were able to reorganize and promote from within and provide these opportunities for our highly dedicated, highly skilled team members. And I have full confidence in them all, and I wish them all the best. Congratulations, and they have my full support.
Thanks, Fran, for that message. Congratulations to all of those that are being promoted in that restructuring. We look forward to their success going forward. Speaking of that, Dennis, there's something you want to share with us about some of our analytics folks.
For sure.
Some good things.
For sure. Another group of talented people. So we want to recognize there's two people within the analytics department who are being presenting at a national meeting. And Fred, we talked on this video a couple times about one of our critical success factors in the beginning of the pandemic was having access to data.
That's right.
So that we could make smart decisions about how to move forward, and we had, I think, access to data that nobody else did in the region, and that's because of these individuals and others.
That's right.
Michael Hauk, who is going to present a breakout session called Analytics Emergencies, Rapid Deployment of a Real-Time Analytics-Enabled Incident Command. And we saw that happen.
We did, and Mike was really interesting. He says he's been waiting his whole career for an analytics emergency.
Well, he got one.
We gave it to him.
And he's going to present nationally about that. And Brendan Philbin is going to lead a machine learning marketplace session on COVID-19 local and regional growth modeling. And so this is the numbers we looked at where we were trying to predict what's going to happen and model that so that we were prepared for the various phases of staffing.
Very, very important for us to understand that.
So congratulations to both of them, and we thank them for their efforts. And finally, Fred, I'm wearing a Double H shirt today. I know that Double H is something that's very important to me. For those who don't know, it's a camp up in Lake Luzerne for children with medically qualifying conditions, and my wife and I are medical volunteers there, and we do it every summer. You are very involved with JDRF. I know that's a charity that you're involved with.
We have been for many years. My wife and I've been on the board of JDRF, the local chapter, for the past 3 years.
Yes.
Very important work that they do.
Yes, for sure. And with Double H, we would normally be up there doing sessions at camp. Like the rest of the world, they've gone virtual this year.
No.
And so today I was able to remote into a camp session, and one of my favorite campers, Ashley, was on today. We normally are together at session 2, but I just wanted to shout out to her and the rest of the campers at Double H and thank the incredible staff up there, which Albany Med has partnered with for over 20 years.
That's fantastic.
To provide the doctors, the nurses, and the respiratory therapists up at Double H. So shout out to them.
So important to them.
Yeah, for sure. Now, Fred, I'm not here next week, so you'll be having some
You're getting-
co-pilots.
That's right. You're getting some very
Yes.
well-earned recreation time with the family.
For sure, for sure.
So we're going to have a couple of guest co-hosts.
Okay.
I'll let the viewership out there think about that. I won't share who they are yet.
Okay, very good. We'll look forward to that. And then finally, you had mentioned earlier in the week there was something about today's video. So the coffee and donut will be on me.
Okay.
For the first, I'm going to say the first 5.
Okay.
I'm going to raise the bar. See if we can get 5 people to predict what happened.
Okay.
All right.
Send us an email. Let us know what you think.
All right, very good. All right, we'll be back again, or you'll be back again next week. Yes. I'll be back in about a week or so. So we ask that you once again, please take care of yourself, take care of each other, and we'll see you next week.